Hi student, welcome to Nursing Guru. Today we are discussing about GNM second year Medical Surgical 1, some important question for GNM student. So medical surgical nursing 1, practical and theory both are there. So practical will be conducted from clinical area or hospital and theory will conducted in classroom. So now going to talk about the theory classes. So first one, in medical surgical nursing 1, total 14 unit is there. So first one talking about the introduction. So first one introduction, it will 3 question will come. This important question for you people. So first one, definition of health, and second one, health illness model, and third one, nursing process. Second unit, nursing assessment. Under nursing assessment, 2 important questions is there. First one, nutritional assessment, and second one, physical examinations. Physical examinations means head to toe. Unit 3, alter immune response. Here 3 types question will come. Objective type question will come, essay type question also come, and short type question also come. So here important question, the hypersensitive, that is the more important question for you people. Next, the fluid electrolytes balance. Here so many disease condition is there, like hypercalcemia, hypernatremia, hyperkalemia. So in this, that is one kind of disease condition. So how to write the disease condition? First you write the definition, after that you should write the causes. Next unit, fluid electrolytes balance and imbalance. So under imbalance, some disease condition is there, like hypocalcemia, hypomagnesium, hyponatremia. So how to write the disease condition? First you should write the definition, after that you should write the causes, after that you should write the clinical manifestation, after you should write the diagnosis test, after you should write the management. Management is 3 types. First one, the medical management, surgical management, and nursing management. So according to management you should write. Next unit, operation theatre technique. In this unit, 3 questions is very important for you people. So first question, the peri-operative assessment, post-operative assessment, and the pre-operative assessment. That is the important question, how to before surgery, after surgery, and during surgery. That is the assessment of the operation theatre. And one more question is there, the general set instrument, and one more question last, the position, how many position is there during the surgery. That is also one kind of the important question. So 3 questions you should study. Next topic, management of patient undergoing surgery. You will get the 3 types question. First one, the long essay, easiest short essay, and objective types question will come. So first one, the pre-operative preparation care. The first question, it is the very important for GNM students. And one more is there, the pulmonary tuberculosis, one kind of the disease condition. So you know how to write the disease condition. First one, you should write the definition of the pulmonary tuberculosis. In this unit, pulmonary tuberculosis and pneumonia is very important disease condition. So if people know how to write the disease condition, and how to write the disease condition, you need the definition, causes, signs, symptoms, diagnosis, evaluation, and management. So one more question also there as a short question. So tracheostomy care. Another unit, nursing management of patient with GI disorder. Under GI disorder, some disease condition also is there, like peptic ulcer, gastritic, and gastric cancer. That is get the long essay. And short essay question will come, like endoscopy, hernia, and hemorrhoid, and last one, the assessment of client with GI disorder. Next unit about nursing management of patient with metabolic and endocrine disorder. In this unit, sometime question will come, Mr. X age was 25, admitted in post-operative ICU after thyroidectomy for hyperthyroidism. So hyperthyroidism is should like that one kind of the disease condition. So how to write the disease condition? First you should write the definition, causes, signs, symptoms, and diagnosis test, and last one, the management. Another unit about nursing management of renal disorder. So under renal disorder you will get more question. Sometimes you will get the long essay, like nephrotic syndromes, renal failure, and UTI. In this unit, sometimes you will get some short essay types question, like hydronephrosis, trauma of bladder and kidney and uremia. Like that question will come. Another unit about nursing management of patient with neurological disorder. Under neurological disorder, long essay question will come. So like the epilepsy, seizure and epilepsy. So if people know how to write the disease condition. After that, the brain injury, spinal injury and head injury, Bell's palsy, like that question will come. And short question, Alzheimer disease, multiple sclerosis and neurologic bladder dysfunction. Another unit about nursing management of patient with connective tissue and collagen disorder. In this unit, one important question will be there, that is the osteoarthritis. Yeah, next question, explain about gout. In this unit, two important questions will be there. First one, the osteoarthritis, and second one, the gout. This is the last unit, management of elderly. In this unit, only short essay question is there. So first one, assessment of elderly, second question osteoporosis, and third question dementia. Only three questions important for this unit. So we have discussed about medical surgical nursing for GNM student, few important questions. I hope it is clear for everyone. If you have any doubt, just comment below. Thank you for watching video.